Well, there's a laboratory normal for cholesterol, and when doctors look, we usually obtain a cholesterol panel. You can screen with a total cholesterol to get a ballpark figure, but ultimately we normally get a fasting lipid panel, which includes things like total cholesterol, something called the high density lipoprotein or HDL cholesterol, which is the good cholesterol, the LDL cholesterol, which is the low density lipoprotein. That is the bad cholesterol. That's the one that we mostly target, that LDL. And I'll come back to that in a minute. And then we normally get a triglyceride, which is another fat that goes around in your blood and is another risk factor for cardiovascular disease. The LDL cholesterol is the one that we really target, and there's a lab value of about 130 on that LDL cholesterol, above which by laboratory values you're considered to have an elevation. If you're less than 130, you're okay. New guidelines for the treatment of cholesterol actually use cardiovascular risk in setting that target. So actually that target could actually be set a little higher if you're very low risk, such as the LDL could be less than 160 if you have a very low risk of cardiovascular disease. The average value is 130. If you have heart disease or diabetes, that value is set less than 100 for your LDL cholesterol because you already have the disease, and we certainly want to try it. Sometimes we want to try to reverse that disease process, so we want the cholesterol even lower, so it's less than 100. Actually, if someone has a very high risk, and especially with heart disease, established heart disease, sometimes we want that cholesterol less than 70 on that LDL cholesterol. So it is very based upon your cardiovascular risk.